I want you to imagine the human body's circulatory system as this incredibly intricate plumbing network. Think about it. You've got miles and miles of pipes, a central pump keeping everything moving, and precisely the right amount of fluid rushing through to deliver life-sustaining oxygen to every single corner of a sprawling city. But what happens when that vital system critically fails? Well, welcome to this explainer. Today we're unpacking the high-stakes medical emergency known as shock. We are going to map out exactly how this system crashes, the specific ways the pipes in the pump break down, and how medical professionals literally race against the clock to diagnose the exact point of failure. Here's our roadmap for this explainer. First, defining the syndrome. Then, hypovolemic and cardiogenic shock, followed by distributive and obstructive shock. After that, we'll cover spotting the warning signs, doing the diagnostic detective work, and finally, a summary of system failure. Okay, let's dive into this with Section 1, Defining the Syndrome. Now, in everyday conversation, we throw the word shock around all the time, right? Usually to describe an emotional reaction to a sudden fright or some really bad news. But medically speaking, shock is an intensely physical, absolutely life-threatening syndrome. It's defined as a syndrome resulting from a severe decrease in the effective circulating blood volume or fluid in the body, triggered by an injury or an illness. Basically, the fluid in the pipes drops to critical levels and the city starts losing power.
So the crucial point is that this drop in effective circulation doesn't just happen one way. It's not a one-size-fits-all issue. There are actually 4 highly distinct pathways to this system failure. We're looking at hypovolemic, cardiogenic, distributive, and obstructive shock. Each one represents a fundamentally different mechanical breakdown in our body's plumbing.
Let's look at the first two. Section 2, hypovolemic and cardiogenic shock. Basically, the fluid leak and the broken pump. To use our analogy, this first one is what happens when there's a massive leak in the reservoir. Type 1 is hypovolemic shock. Hypo, meaning low, and volumic, referring to volume. It's exactly what it sounds like. This occurs when the circulatory blood volume is severely reduced. The fluid is literally leaving the system. Now, this can happen through direct blood loss from an external injury, or honestly, even from significant blood donation. But it also happens internally, completely out of sight through things like a ruptured blood vessel or an ectopic pregnancy. And crucially, a lot of people miss this, it's not just about losing red blood cells. Severe fluid loss alone can cause hypovolemic shock. Massive burns, excessive vomiting, or severe diarrhea can drain the body's fluid reservoir so drastically that the circulatory system just runs dry. Then we've got type 2 cardiogenic shock. In this scenario, the fluid levels in the body might be perfectly fine, but the pump itself, it's broken. The heart is suddenly unable to pump sufficient blood out to the rest of the body. The causes here are entirely centered on the heart muscle's function. A classic heart attack or myocardial infarction damages the muscle so it just can't squeeze properly. But it can also be caused by cardiomyopathy, which is a disease of the heart muscle itself, or severe cardiac arrhythmias, where the electrical timing of the heart gets so chaotic that the pumping action becomes entirely useless. Let's move to Section 3 and see how this builds. Distributive and obstructive shock, the pipe failure and blockages. See, the fluid and the pump aren't the only variables here. Sometimes the problem lies in the structural integrity of the pipes themselves. Type 3 is distributive shock. Imagine if all the water pipes under your street suddenly expanded to 3 times their normal size. The water pressure would instantly drop to 0, right? That is precisely what happens here through excessive vasodilation, which just tanks your blood pressure. There are 3 main subtypes to know here. First is septic shock, which is actually the most common. A severe systemic infection causes the body to release cytokines, and that triggers massive, system-wide vasodilation. Then there's anaphylactic shock, where the immune system wildly overreacts to an allergen, releasing huge amounts of histamine, sometimes in literal seconds, that wildly dilates the blood vessels. Finally, we have neurogenic shock. This typically happens due to a spinal cord injury. The autonomic nervous system is damaged, meaning it can no longer tell the blood vessels to stay tight. The result? Again, uncontrolled vasodilation. Now for type 4, obstructive shock. Here, a physical obstruction in the circulatory system is stopping the blood from flowing properly. We can divide this into 2 clear causes. First is mechanical compression. Something is physically squishing the heart or lungs. For example, cardiac tamponade, where fluid builds up in the sac around the heart, the pericardium, squeezing it so tight it can't even fill up with blood. Or a tension pneumothorax, where air escapes the lungs, gets trapped in the chest cavity and literally crushes the cardiovascular structures.
The second cause is vascular obstruction, an actual blockage inside the pipe. This includes things like a massive pulmonary embolism, a giant blood clot in a lung vessel, or aortic stenosis, which is a severe narrowing of the aortic valve, or even an aortic dissection, an incredibly dangerous tear right in the wall of the aorta itself.
Section 4. Spotting the warning signs. Let's look at the symptoms. The common symptoms of shock really tell a story of a system desperately fighting to survive. Across the board, you're going to see a dangerous drop in blood pressure. Because oxygen isn't reaching the organs, you begin to see immediate signs of organ damage. The brain suffers, leading to severe confusion. The kidneys take a huge hit, resulting in oliguria, which is a sharp decrease in urine production. Simultaneously, you'll see the body going into absolute overdrive trying to compensate for the failing system. The heart rate spikes and breathing becomes really rapid as the body practically begs for more oxygen to be circulated.
But here's a fascinating visual contrast. In the classic compensation phase of most types of shock, think hypovolemic or cardiogenic, the body actually diverts all remaining blood away from the skin to protect the absolute vital organs, like the brain and the heart. This leaves the patient's skin feeling cold, sweaty, mottled, and sometimes even bluish. However, there is a massive exception to this rule. Remember septic and anaphylactic shock, where the core issue is massive vasodilation? Because all those surface blood vessels are wide open, those patients actually present with warm, flush skin. It's a critical difference that immediately hints at what's going on underneath.
So, what does this all mean for the medical team? If low blood pressure, confusion, and a racing heart happen across multiple types of system failure, how do doctors know exactly what is damaged inside? Is it a pump problem, a pipe problem, or a volume problem?
Well, that brings us to Section 5, Diagnostic Detective Work.
And this brilliantly illustrates how doctors map the internal damage without ever making a single incision. The answer lies in the blood. They run very specific diagnostic tests. For instance, a high blood lactate level indicates that tissues just aren't getting enough oxygen, confirming the severe reality of the circulatory failure. If they see high creatinine levels in the blood, that specifically points to kidney damage. And if they find high troponin levels, well, that is a direct distress signal indicating severe heart damage, which strongly points toward cardiogenic causes. These markers are essentially the biochemical footprints of the exact type of shock that's happening.
All right, Section 6, Summary of System Failure. Let's bring it all together. To recap all of this, shock is not an emotion. It is a profound, life-threatening decrease in effective circulating volume. We've seen that it's triggered by 4 distinct types of mechanical failure. Hypovolemic, when the body loses fluid. Cardiogenic, when the heart pump fails. Distributive, when the pipes inappropriately dilate. And obstructive, when physical blockages stop the flow. This crisis is recognizable outwardly by dangerously low blood pressure and failing organs, and it's confirmed internally by precise blood markers like lactate, creatinine, and troponin.
Ultimately, saving a patient isn't just about recognizing that the system is crashing. It's about finding out exactly why. Because, and this is a huge takeaway, there is absolutely no single definitive management for shock as a blanket condition. You can't just treat shock. Instead, survival requires a rapid medical response strictly tailored to the specific underlying cause. Understanding the exact type of shock is the crucial difference between fixing a leak, clearing a pipe, or repairing the pump. Applying the wrong solution in these critical moments can literally be fatal. It really is a testament to the incredible high-speed detective work happening every single day in emergency rooms around the world. So, the next time you hear the word shock, you'll know exactly the complex mechanical battle for survival it truly represents. It kind of makes you wonder, doesn't it? What other hidden systems in the human body are just one failure away from a total crash? Well, we'll leave that for you to think about until our next explainer.